folks. Got a bit to talk about today, mostly talking about the health center today and some of the information that the state has put out there in the last few days. I want to start though with some of the questions that I've gotten lately relative to when we're going to, or if we're going to open more doors in the individual, at least here at Williamsville, in the individual villages so that residents can more easily come back in. And I can tell you that the decisions on that are forthcoming. So I think I mentioned last week I'm meeting with the resident council later this week. The governor's pause order in New York State actually ends at the end of this week. And then we're going to make some determinations going forward about how we open up the campus. And so for those of you who've been asking those questions, I certainly can understand the question. And they're on the table for discussion and for decisions as we move forward. Excuse me. So late last week, I believe on the 7th of May, Governor Cuomo issued an executive order, which is basically a law. And within that executive order, specific to health centers, skilled nursing, and assisted living, there's two very important caveats. The first one is he issued an executive order to start this week that all skilled nursing facilities and assisted living facilities implement mandatory testing of their staff twice a week, mandatory testing for COVID. So at first blush, you have to say, wow, that's great. And you've heard me up here being a big advocate for testing, and we certainly are big advocates for testing. The challenge with that, and I can say it's going to be a huge challenge, is there's nothing in the mandate stating how we're going to do that. There's no funding. There's no direction as to locally within the different areas of New York State who will be doing this testing. We're going to have to test. We have about 200 people in this classification within the health center, 200 employees, of which we're going to have to test twice a week, so that's 400 tests. Keep in mind, the average weekly total of tests that's done in Erie County is about 7,000. So if you add up all the nursing homes and then their staff and test them twice a week, you're going to add between 12 and 15,000 tests to a county that only averages 7,000 tests a week. How they're going to do that, I have no idea. So again, it's very poorly thought out. It's one of these mandates, unfortunately, that tends to come from the state of New York, where they issue these mandates knowing that it's going to be extremely difficult, if not impossible, and basically tell you to figure out. But believe me, I'm advocating for testing. And I think this is a step in the right direction, but it's a misstep. And it's part of what I'll talk about as well, about this unfortunately irresponsible, reactionary stance on nursing homes, particularly in New York State, but throughout the country, relative to trying to contain the virus in the nursing homes after they didn't contain it, they being state and local governments, specifically state governments initially. And I'm going to talk about that because, again, this is now a political issue. We still hear in New York State, which is true, that the virus continues to ravage nursing homes. There's no question about that. And unfortunately, some wonderful nursing homes who do an outstanding job are being hit the hardest because of impossible conditions. So within the governor's, within his executive order, which happened on the 7th, there was a caveat in there as well. And at the end of it, it says, any general hospital shall not discharge a patient to a nursing home unless the nursing home operator or administrator has first certified that is able to properly care for such a patient. Provided further that any general hospital shall not discharge a patient to a nursing home without first performing a diagnostic test for COVID-19 and obtaining a negative result. Sounds awesome, right? And it's about time they did this, because you've heard me talk time and time again here, and it's really the basis for all of the protocols that we've had at Canterbury Woods for 2 months now about not importing the virus into the health center, because that is the major cause of the issues that you're seeing across the state. Now, what I'm going to point to is a Department of Health directive, the Department of Health directive on this subject. I have it right here. You can look it up. All of these are public documents dated March 25th, 2020, from the New York State Department of Health. And it says, no resident shall be denied readmission or admission to a nursing home solely based on a confirmed or suspected diagnosis of COVID-19. Nursing homes are prohibited from requiring a hospitalized resident who's determined medically stable by the hospital to be tested for COVID-19 prior to admission or readmission. So the directive that nursing homes in New York State have been operating under since March 25th, based upon this directive, says that that nursing homes could not deny readmission or admission of nursing home cases, whether they were COVID-19 or positive or negative, from hospitals back into nursing homes. And nursing homes couldn't even request or require that these patients be tested so they knew whether they were positive or negative upon admission to a nursing home. Dated March 25th. So folks, that is the foundational platform which started, or which certainly exacerbated, all the issues, or most of the issues, that you're seeing in New York State. Since March 25th and up until May 7th, nursing homes had no choice. They had to admit their residents, any resident, back into their nursing home, COVID positive or not, and without a test. That's just the way it was. Now, I'll preface this by saying, and you've heard me say this here before, that the reason is because the first reaction by New York State was our hospitals are going to be overwhelmed, understandable, and we need to do everything we can to make sure that we have enough access to our hospitals to handle what was coming. We all get that. But it created this problem. Created the problem that you're seeing now in New York State with the thousands of deaths that are in nursing homes. So unfortunately what's happening now is New York State's trying to fix it, or trying to give it attention, or saying that we need to concentrate on our elderly, we need to concentrate on our nursing home population. That's great. However, the fixes aren't going to do a lot to solve the problem. Canterbury Woods has been saying this needs to be fixed for 3 weeks. If you look back to our town hall meeting that we did, or I did, on the 22nd of April, it's out there on YouTube, you will hear me say exactly what the governor, his executive order, says. And we actually negotiated this with the hospitals on 4/22, just before then, that our residents would not be coming back here without a negative COVID test. Period. End of story. Unfortunately, it took the state of New York 3 more weeks to figure it out. So, the good part of this is the testing. That's positive. We're going to move through with the state's plan, or there's no plan, I'm sorry. We're going to move forward with the state's directive, and we are in the process of formulating a plan. We have to submit that to the state by the 13th, and we certainly will do that. We're reaching out to who we think might be the providers of testing. Could be Kaleida, could be Quest, could be other agencies, and try to work with them to come up with a plan. Here's the other reality, folks, is if you test all of your staff members, let's say you test them on Monday. Now, I don't know how you test 200 people in one day, specifically within healthcare, because everybody doesn't work in one day. And you have part-time staff. You have per diem staff that show up once a month. So logistically, it's a nightmare. So let's say you could do it. Test 200 people on one day. So let's say you wanted to test them again on Thursday or even Friday. All the tests from Monday will not even be back by the time you retest them again that same week. And that's the reality, especially when we flood the system with the amount of tests that are going to be flooded into the system. So the challenge is, what we have to work through, it's pretty awesome at this point in terms of the stuff that we have to work through. You know, it goes back to, I think, what we've been saying nationally, which is more testing, more testing, more testing, more testing capability. This doesn't help. But we're going to do it. We believe in testing. We hope to continue to work with the state and our advocates at the state level to work through this process, to get it to a process that makes sense. I can tell you that we've tested many staff members to this point. Chuck, who's in the back of the room, Chuck has been tested. Came through with flying colors. I've been tested. Flying colors. So we have incrementally tested staff. We plan on testing all of our staff for antibodies starting in June. Canterbury Woods will pay for that, and we will continue that. So we're big fans of testing. We're not big fans of bad planning, inability to execute, and trying to make up for bad guidelines. I'll leave you with that, and see you on Wednesday. Thank you.